doing their certifications for ACA, doing their certifications for Medicare. Let's talk a little bit about it, because I'm sure you're not the only person who's having those types of issues, and make sure that everybody's got that done. We do have a prerequisite that is due by the 18th, which is tomorrow. So that means that everybody should have that completed. And that is going to be our ACA certification. So just really quickly, let's go back. If we're logged into Florida Blue, everybody is probably nauseated at the fact that I'm going over this again. However, let's just do it one more time. Come into Florida Blue. You can access the Florida Blue Learning down in the sales and training support at the bottom. You could also access it by clicking on sales and training support at the top. And then if it had teeth, it would bite you. There it is right there. It's going to open up our GuideWell Connect Learning Center. We're going to click on the happy little library books up here. Now, what's due on the 18th, tomorrow, everybody needs to do it, is this ACA for agents and brokers.
Here, complete this, you'll select it. I don't know what that is. Start it. Hold on one second. Gig.
Oh, I don't know. I can hear myself through your office, it sounds like. Oh, there it goes. It's done now. In some way, shape, or form, have looked at the portal.cms.gov. Okay? So when you're in here, some people are saying they can't hear me. Everybody can hear me now. Might have just been an issue. There you go. Perfect. All right. So when we get into cmsportal.gov, you should be logging in, and you should be completing the refresher courses. So with those refresher courses, they are a short process, a few hours of your time. And once they are completed, please take note that you do need to email those certificates along with your national producer number, FFM user ID, to FFM certifications at Florida Blue. This is missing from the agent service bulletin. I'm going to put the email address in the chat log for everyone, hopefully. Here we go. And that way you guys you have that, and you should be sending that appropriate information out to them, okay? So once that way Blue Cross will have your link prepared. Now, when that link preparation is done, that is the connectivity between IST, the individual sales tool, Florida Blue website, remember it's got like 18 different names, and the marketplace. So when I'm going from Florida Blue out to the marketplace to look up an application. To complete that application, they need that certification process. They're going to need that to verify that information. Okay? Beautiful. Has anyone had any problems with either this CBT, computer-based training, understanding the Affordable Care Act requirements for brokers and agents, or the CMS Portal Learning Center? Okay, everybody's got that, no problems. Beautiful. We really want to get that done and make sure that that's completed, because there's obviously more training on the way. Now, as we go back to the training modules, those of you that are selling Medicare are also going to have to complete our Medicare core curriculum. Question coming in here from Paul. Good morning. It's really hard to navigate CMS Center. Well, it is a governmental website, so let's just keep that at hand as well. And there are, it is a little cumbersome, but what you just have to remember, if we review and we go back to the slides that we had gone over in some of our other trainings, you will see that where it's going to get confusing really is after you register. So if we go through these slides real quick for everyone, just in case Paul's not the only one that's feeling this, because I felt it as well. Get logged in, make sure that we're going through that process. We could see here, I'm just going to get click happy and go right through this for you. Go through. Now here is where the confusion starts. Now, if you were certified last year, you sold business last year, you will click on curriculum status, and that curriculum status is going to bring you to the refresher courses. Where it's a little difficult to understand what you've got to do is you've got to do them in order, and they don't put them in order for you. So just take your time, go through it. You can't complete the agreements until you've done all of the other prerequisites. So that's where it gets a little confusing. Once it's done, you will get a course completion, and that course completion is what needs to be sent to Florida Blue. So yes, I agree with you, Paul. It's not the best thing out there. Question coming in from Brett, which can we use any of the other CMS vendors? The answer is no. You can. However, Florida Blue is not going to support any problems or issues that you have with AHIP, National Association of Health Underwriters, or Litmos by Calidus Cloud. Those are also 3 options. But if you have a problem, if your test scores are not communicated to Florida Blue, then they won't be able to support or help you. The best way to do it is go through that Marketplace Learning Management System, the CMS system. Any other questions, concerns, comments? Just happy to be here. I know I am. Starting to pull my hair out already thinking about all the stuff that we've got to do. So let's talk a little bit about the core curriculum now. So moving our brains to Medicare, I know it's a lot, but we are definitely moving that direction as well. And with that core curriculum, illness, which is going to be, it's been released, we really need to start looking at that more and talking more about that. You know, because of the alignment story and our partnership with Alignment, you know, we have to make sure that we are very well educated and being able to tell that story about alignment. And I know a lot of us get very uncomfortable and, well, maybe aggravated. There are a slew of words that I could use here, frustrated with the network. Now, what I want to remind everyone is when we're dealing with these particular types of products, the competition also have these narrow sculpted networks that we're accustomed to. That sculpting is done last year. So the big hit and the big, you know, anger factor that we all dealt with should be over. But when we are now marketing our products, and this goes along the lines for ACA as well as Medicare, historically, how did we sell our products? It was all about the network, right? And, you know, what we're really going to have to make sure that we're very comfortable with is talking about the benefits and selling on the benefits. The benefits are strong. Yes, they're close, but we have other value propositions that need to be talked about as opposed to just the network and you're going to be able to see your doctor, because you may not. Now, granted, with a regional PPO and, Medicare supplements, which those are things we need to talk a lot about this year. But for those individuals that are looking for low copays, low out-of-pocket, zero premium, they have to understand that those things don't come with a broad spectrum network that they can go anywhere in the world that they would like and have huge levels of flexibility. With giving up that flexibility, there's a cost to it, right? So anything like if I want all the bells and whistles, I want to go wherever I want, I've got to pay for it. I am not going to get a car with power windows, power door locks, AC, autonomous driving, and all of the other good things that I want, and it's going to be cheap. It's going to be more expensive than if I've got to roll down the windows. Does anybody remember when we had to unlock the doors and all those kind of things? Wow, all of that manual stuff. But these, times have changed. People who want that ease of flexibility, you have to be comfortable with talking about the Medicare supplements and going down that path of most expensive to least expensive. And I know most of us do that when we're marketing Medicare, but it really is going to be important this year because that value proposition where you're giving up in most cases is the network. So is having the added value benefits that you're going to see in the product, is that going to outshine the network? Now, granted, PCPs are going to be hard pressed to change, but, we always have this conversation year after year, and many of you that have been with us and have heard our conversations, we can't, if it's a dermatologist, if it's a podiatrist that somebody is looking, they may just have to change. Is the hospital that is closest to them the hospital that they're going to see? Probably. Typically our specialists and hospital networks are strong. And as we get closer to, product being released and we talk about, sales processes for that, we will talk more about it. But especially in the Medicaid, Medicare, the dual markets, the chronic illness markets, they're accustomed to these small, narrow networks because they're getting a lot of value, a ton of value with their particular product. Is everybody comfortable, before I move on, just with the highlight from 10,000 feet above, the story of alignment and the quality of care? And you're going to read more about it. It's part of the product training when we go through it. But I just want to touch on it. Does everybody on the call today, all of our agency partners, have a good understanding of what alignment is, our relationship with alignment? Should we spend some time on that? Okay. Seems like most everybody is pretty comfortable with that. Definitely something you want to talk about. There are some materials inside IST. We have some videos in your Dropbox that Gigi has shared with everyone that talk about the alignment story and really being much more responsive to health and well-being for our membership, getting people into the Jumpstart program. These are all things that are very important that we need to talk about because it is a significant value proposition that we need to give to our customers. Okay. So now kind of open up the stage to some ACA, and let's talk a little bit about issues with servicing and billing and any type of issues that you guys are having. As I have seen, we are starting to have a much better activity level from the marketplace. Believe it or not, the marketplace is actually doing something right for once. They have committed to us that since we cannot pay for a customer that has an SEP, that you are definitely out there in their face. What will happen is the CMS and the upload of those documents are getting approved in about 3 to 4 days. Now, there still is not a good communication process from Florida Blue to us, shocker, that will inform us that a binder payment is due and is available. And I just want to review that really quickly for many of you that haven't been on some of our calls. That new process is we submit an SCP, we cannot pay for the policy, we upload the documentation, and about 3 to 4 days later, we would then be able to make a payment on that policy. Unfortunately, the communication is all done directly with the consumer. And as we know, consumers don't usually do much to pay attention. So we need to put something on our calendar after we've uploaded the documents 3 to 4 days later to first make sure that they were approved. If you are uploading, there are a lot of different options that you can upload depending on the SEP. It doesn't have to just be a loss of credible coverage. Now, that being said, just about a week or so ago, Florida Blue released a new document. Well, it was updated, a form for accessing non-calendar year renewals. So this was located in an agent service bulletin, and many of you understand the process and the rules, know that anyone who has Florida Blue, a pre-ACA underwritten plan, currently has an SEP, because those changes and those rate increases are done in July and August. And there is a 60-day window for them to change to a qualified health plan if they so desire. Now, for many of these folks, it doesn't really make sense. But if it does make sense for them financially, maybe now they're eligible for a subsidy or what have you. Remember, once they get off that plan, they are never, ever, 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 ever getting it back. You can upload a letter. That letter can be from you, but also Florida Blue has given us this nice form on Florida Blue letterhead that you can print in this agent service bulletin, agent signature and phone number, and this could be the verification for the eligibility for the non-calendar year renewal. So you can use this form. So if Mrs. Jones comes into your office and says, I've got a old plan 71 hospital surgical plan, you know, it doesn't really do much for me. I had it when I was younger. Now I'm a little older and I need to go to the doctor. I need doctor visits. I need other coverage besides just hospitalization. And they want to change to a plan. The marketplace is going to require some sort of documentation. And if that documentation is right in front of you now on my screen. So make sure that you're taking advantage of that. Is anybody having a problem with the SEP process of proofing and getting those people paid? After it is approved, you can contact agent services, or the member can contact membership and billing directly, get the H number, and make their payment. If you obtain that H number, you can also help them and assist them with that payment process. Everybody comfortable with that? Okay. Any hurdles that we're having when it comes to sales or marketing? Okay, question coming in from Justin. Mark, could you go over the correct process for adding a new board to a parent's plan? I recently heard some conflicting information. Well, there's going to be two processes for that. Well, the first thing you need to understand is that there's no compensation for an add-on. So if you're adding a child to a plan, then you're not going to get paid for it. So just FYI, if that makes any difference. So if we're an on-marketplace plan, it's very easy. We go out to the marketplace. So we would just simply, from our home screen, process an application. We would go out to the marketplace, and we would simply go through this. Report a life event, add the child's birth date in there. That is within 60 days. The policy will be backdated to the birth of the child. That SEP will be good for a 60-day window. It will always be backdated to the birth of the child. So if we're talking about off marketplace, you've got a couple of choices. You could write a child-only policy, and then you can merge those policies together during open enrollment, so that way everything works nice and smooth, and it really depends on what you're looking to do. Off marketplace child only is typically the best way to do that. If you are, what conflicting information were you getting, Justin, or what were they telling you how to do it? If you were managing that policy, you could also, from an off marketplace management of the policy, you could do that and add the child there as well. Really depends on what you're trying to accomplish, what plan they're trying to select. Is there an aggregate deductible that we need to be aware of? Are they joining an HSA plan? Do they need to be on the same plan? Is there a subsidy off marketplace? Lots of questions, but that is, I'm not answering your question with more questions, but these are the things that I'd like to identify before I can give you the information for the conflicting information. I submitted one on the 15th, uploaded the docs the same day, still waiting to get approved. Well, that's 2 days later, so it's within line. So if you did it on the 15th, I would give it another day or two. If you verified those documents, I would just double check on that and see how that's going. Where do we send our individual marketplace completion certificates? The address that I put into the chat log. ffmcertifications@floridablue.com. We have a lot of renewals that are not our AORs. Can you address that sometime in the future? I guess that we should redirect them to their AOR. Now, I'll touch on that in a second, Martin, but that's a great question. They said they have to have the member call member services and fill out a paper application, and we'll update. Justin, we could take that offline. That is conflicting information. I wouldn't do a paper application come hell or high water. Just me. But we can take that offline and go through it. You just need to copy the email address. Don't click on it. It's ffmcertifications@floridablue. Just copy the email address, and we'll send it out again at the end of this call today for anyone else who's having a problem getting that email address. I had a client that wanted to change their plan after her baby was born. Baby born on 1/22. They applied for coverage on 2/14 for a 3/1 effective date, but Florida Blue changed the effective date of the new plan to 1/22. That would be correct. Now not paying hospital charges. Their way to have an effective date requested day. Customer service is telling me no. Customer service is correct. So you don't have a choice for an effective date. It is what it is, right? So the baby's charges, so if we're talking about this, again, let me repeat this so everybody can hear it. Had a client that I did a plan for, and me and an agent in our office just went through this 2 days ago. So it's a good commentary and a good talking point. If I make a change to that policy, I can change it within 60 days. So as long as I enroll that member, I can continue to make changes during the SEP period, but all of those changes are always going to effectuate back to the birth of the child. So I understand, but you're saying now they're not paying the hospital charges. That would be incorrect because the mother's plan is, if there's a mother on that policy, there should be two policies, right? So the mom's policy, depending on what the date of service was, depending on when the mom entered the hospital, they shouldn't be billing the baby's policy. They should be billing the mom's policy. And this is the exact same situation that we had just the other day. So it's really funny that you bring it up, because what we had done is the mom was on a gold plan, right? Mom was on a gold plan because she knew she was going to have a baby. So she, selected a gold plan at the end of open enrollment. She was one of those stragglers that waited to the last minute. Baby was born in July. So we did an SEP. The SEP was backdated to the birth of the child, but when we did that SEP, we changed both the mom's policy as well as the child's policy, therefore taking the deductible from 0 to a much higher deductible because they are very lightly subsidized people. So when they did the billing, they billed it to the new policy with the high deductible rather than the old policy, because the same day that the mom went in the hospital is the same day that she gave birth. And that was the problem. So we identified this problem early enough and were able to log back into the marketplace. Now, we had to do this through the member account, but what we did, we logged into the marketplace, we separated the family into groups, gave the baby the policy that we originally looked at with the subsidy that was applicable, and then left the mom on the gold policy. So therefore, the hospital charges were paid on the gold policy. She had much less out of pocket than she would have if she was on the silver policy, A variant that they were looking at to move to. That's a lot of information. But really, the answer to the base question is no, you can't choose your effective date because it's an SCP and the SCP rules are going to follow. Make sense? Did I confuse everybody even more with that? Now, if you make a mistake, Paul, unfortunately, it's long gone. Your particular case is that ship has sailed. But if you were still within the 60-day window, you could have fixed that. Okay? Okay. So let's talk a little bit about what Martin has brought up, and that is rules surrounding AORs and renewals. Now, I just want to preface what I'm about to say with no business rules have been described or finalized from Florida Blue. We have not signed a 2018 commission addendum. Therefore, we don't know what the final business rules are going to be. There's a lot of talk about different activities and the way that things are going to be. So what's going to happen is what they're talking about doing is they're talking about not paying a renewal unless it's your AOR. And that's kind of what Martin is bringing up. And he's stating that we did a lot of renewals that weren't our AORs. And can you address this is basically what is going to happen during open enrollment when Mrs. Jones calls into our office and you are not the AOR. And therefore, your work is not going to be compensated. Well, here's a couple of things before I get into this that you need to understand. Florida Blue has got approximately 1 million members, right? Now, with those 1 million members, the CGAs and MAAs, all of us on this call and everybody that we're all talking about, we enrolled about half of those people, approximately about 500,000 of those people. We did. The Florida Blue Store and Blue Direct, they did a small amount, not even significant enough to even talk about, probably the size of a medium-sized agency or CGA. And then you've got another 450 to 500,000 people that enrolled without any assistance, and we refer to those people as Z codes. So what everybody on this call has to understand is all of the Z codes are up for grabs. That is going to be approximately 500,000 people. We have all of the Molina people that are going to be new business. That's probably another 200,000 members because they're looking at a 44% rate increase. We've got about 20 to 30,000 Humana members that are going to be left in the cold. So there is plenty of business out there. But the focus that everyone is going to need to have is going to be on your client base within your organization and people who worked unassisted with the marketplace. So it's going to be important that when you're scripting and when you're talking with your teams, you've got a good pathway of this. You know, who did you work with? Did you work with an agent? Do you know who that agent is? We are asking for some transparency from the level of Florida Blue to give us some level so we know who did what. So that way we can enhance a positive customer experience at the end of the day. Now, we're not 100% sure on how everything is going to look with passive and active renewals and county makeups and all of that good stuff, but that is one of the business rules that they're talking about, yet it has not been written in stone yet. And I'm sure that they're going to talk something about that at the roadshow, but what we have to understand is it's never been more important than now for you to be addressing, working, understanding, and have a great relationship with your client base. Because additionally, we are going to have some pathways to do enrollments that will help you a great deal where the customer can basically do their renewal on their own and you would still get credit for it. We're going to talk a little bit more about that. And let me just kind of show you a couple of things Blue Cross is enhancing. Some of you may have seen this already, but I'll just kind of go over it. So we know that we can, basically build a proposal here. And most of the time when we're doing things, we are quoting through third-party tools and other ways. And I covered this a couple of weeks ago, but I just want to go through it again. It has a lot of value. So if we go through this and we do a quote, if you really look at the bottom of the screen, you've got two buttons here, check for subsidy and save and continue. Now, this is a really good quoting tool to identify the subsidy. And many of you may have been using this. We at A&B did not use this in the past few years. It wasn't working right, and we didn't really, it just had bugs in it. So we used some other quoting tools that were very quick, but this is getting a lot better. So if I'm talking to this member, it's a household size of 1, they've got $15,000 worth of income, taxable household size, so on and so forth. I click continue. It's going to ask me a couple of questions. If there was a mother on here, it's going to ask about mom, pregnant, or parent, and we can go through here. Now what's going to do is it's going to show me my estimated subsidy, and it's going to show me my estimated penalty. And yes, believe it or not, whether you like it or not, or no matter who you voted for, it really doesn't matter, there still is currently an individual mandate. And before we get off the phone today, we'll talk a little bit about what that looks like in the next month or two. We go and click continue. Now what we can do is we can then apply this information to a particular plan. So we scroll down, And just to review a little bit, there's these little action buttons that you see here. So you can see that you can add a plan, compare, premium breakdown. We don't want to look at health plans. What we want to look at is marketplace plans. If we add a marketplace plan, we can now come down and we could see appropriate subsidy applied, final monthly premium, and the benefits. You can see it's already dropped me down to a C variant. So I can see that I have my zero deductible $950 max out of pocket. If I'm talking to a member and we're debating between these two policies, we can come down and we could update my proposal. And then I have choices at this point where I can send them this plan. Now, how would I go through and send them this plan? Well, what I can do is I come up to this action and I could email this proposal. Don't suggest it because it doesn't do anything but show them a pretty little proposal. What's going to happen is you're going to have the option to do a Consumer Connect as well. This Consumer Connect will send the member those two plans that they can select from and they can complete their enrollment. Now, that could be a renewal and it could also be a new piece of business. So I'm talking with Rebecca, me and her are having a great conversation. There's 45 days to enrollment. I do everything within my power to sell that policy, but she wants to think about it. Shocker. So then what I will do is I would say, great, I'm going to send you a link. You know, there's only 45 days in the enrollment. It's going to be really difficult for you to get me on the phone again. I apologize. We're just very busy this time of year. I'll send you a link, and then you would be able to enroll that policy on your own if you're computer savvy. You're not computer savvy, let's schedule a callback or do whatever you need to do. So that'll be option number one. Option number two is that agents will be able to get a processing link, much like many web broker entities or other carriers that allow you to have a link that you can send to your customer, that customer can do a generic quote and they can enroll. And that could be both a renewal or a new piece of business. So in the counties where we don't have competition, and if you are doing your, customer probing now, you would be able to go through and talk to your customers, identify the ones that are computer literate, identify the ones that would be willing to do their renewal on their own, send them that link and have them do their renewal on their own. That way you can focus your efforts on the counties where there will be competition, on the counties where we will have more conversations that'll have to be had, and you can spend your time more wisely because it's all about a use of time. Now, these processes, unfortunately, won't be released until the end of September, and when they get released, we'll do some training. I'm sure Giggy will send out some documentation to agency owners on how to create those links for your teams and how to go through that process. There is a very good possibility that everything will work as smooth as silk with that. And there's also a possibility that it won't work, but Blue Cross is very confident that these tools will be accessible and working smoothly for us. So, exciting times. So someone's making a comment, the last time I did that, the client had a problem, called Florida Blue. Exactly. So what we have done is we've asked them to remove those phone numbers. So those are the changes that have come up. So previously, and you've never heard me talk about using any type of Consumer Connect earlier, so because I would never recommend it because it did have Blue Cross phone numbers on there. And if somebody called and if somebody had an issue, they could end up calling Blue Cross. Now, not so much. So that's a lot of the differences that we've pushed through where they remove all of those numbers. Your agent information appears there for them to call you directly as opposed to calling Blue Cross and then having that experience. So, but I think we're going to be in a good place this year. One of the key factors to know is it's not going to be a free-for-all, robbing Peter to pay Paul. And somebody mentioned, I think it was last week, I don't know if they're on the call today, is, like Fiorella, right? Or other agencies that are out there and they're just, writing whoever and they call in and they're looking for Justin, or they worked with another agency and they did a renewal, but, they didn't get a bill or they didn't do X, Y, and Z. They're already a Blue Cross member. It's going to stop that bastardization of the book, which is great news, right? So it gives you an opportunity to focus on new business. There's still going to be work to be done. And if you just let your customer go and just see what happens, you're screwing yourself because there's a really good chance they go somewhere else or that policy gets terminated and gets rewritten with another agency. within Blue Cross or outside of Blue Cross, who knows, because I don't know what the business rules are. But what you need to understand is that's where you need to be engaged with that membership. And it's never been as important as it is now to make sure you're contacting those members. They know who you are. They know that the individual mandate is here. And lastly, I want to kind of close with CSR and cost share reductions. So a lot of us are nervous, and rightfully so in some capacities, about cost share reductions being eliminated. Now, originally, we spoke a couple of weeks ago about cost share reduction elimination, and President Trump, he is the president, so Trump, whatever you want to call him. I can imagine what some of you are calling him. We're supposed to go to court on August 21st for his cost share reductions and the fact that they are deemed and potentially deemed unconstitutional. So that's been pushed off, shocker, to end of September, with the hopes that, all of the people in the government will reach across the aisle and everybody will get along and sing Kumbaya and play the bongos together, right? Good luck. But just so they can possibly come up with a plan that would work and would help the American people. Now, where there's some confusion is what happens if the cost share goes away. And I had a conversation with a couple of our agents, and they were confused about it, so I want to cover it because I'm sure others have confusion. Let me ask the question and give me kind of a pulse of where if everybody gets it or not. If the cost share reduction money, the extra money that the government gives the insurance companies for A, B, and C variant people, if they go away, what meta level of plan does that affect? If the cost share reductions go away, what meta level of plans does that affect? Okay, so I think we're getting it. So if someone has got, it doesn't affect all of them, it only affects the silver plans, because the silver plans are the only plans that are receiving money from the government to give them a better style of policy. It's how we take our standard 1443 and get it to a 1443C. And the way that that's done is because the government infuses extra money into the policy, which allows Florida Blue to give a better benefit package. So knowing that the cost share reductions are on the table to be removed, Florida Blue and all carriers filed rates or filed footnotes, so that way if the cost share reductions go away, they would infuse those plans with a rate increase. Now, what you have to understand is that if I'm on a silver plan and I'm an A, B, or C variant, but mostly B or C variants are what people are buying, it's probably about 70% of what's out there, 80% of what's out there. Those people, that rate increase will be absorbed. So they've created these plans that look a lot like a 1443C, 1477B. They've created these plans already. They already have the pricing structure there. And if Trump, in his infinite wisdom, decides to pull the cost share reductions off the table, then what would happen is those people would get a rate increase, but they would never see the rate increase on the silver plans because they would be absorbed by the subsidy. The money is still going to come from the government. It's just coming in a different way. So everybody is up in arms saying, I'm going to be out of business if they take off these cost share reductions. No, you're not. Not at all. Where you are going to have a problem is that if you're off-marketplace people or lightly subsidized people, A variant people are on a silver plan, they're probably going to have to drop down to bronze. And I've been privy to some of the new bronze plans that they are filing, which would look a lot like a silver plan, so it would have some copay. So we've got some plans in place, so we're not going to leave people out in the cold. Who's going to be screwed? Off-marketplace, high-income individuals who want a really, really strong plan with low out-of-pocket expenses like a platinum or a gold. They're going to be in a pickle because those plans are going to be expensive. But they're not going to increase so dramatically because they're just going to have the rate increase that's typical, that Florida Blue aggregate rate increases between 9 and 24% depending on network. So those types of things are good for us. at least we're still going to be in business. We'll still be okay, and everything will be right as rain. Not everybody's going to be happy, but whoever is. Does everybody understand that? Because I think there's some confusion about that, and it's really important that we know and we understand that. Now, if they remove the individual mandate, which is probably going to happen or may happen, now if that's the case, all that does is it says, okay, all high-income individuals, now you don't need to buy a qualified health plan anymore if you don't want to. You're not going to get a penalty anymore, so what are you going to do? You're going to go uninsured? Highly doubtful. But a lot of those folks will probably move to some sort of short-term medical solution or some other non-qualified health plan. And if in the event that they fall sick, move to a qualified plan. If they're already sick, they're going to stay. They may just drop down to silver or to bronze or stay right where they're at. And these are the conversations that we're going to be having as we get closer and closer to open enrollment. Does everybody understand that? Maybe better yet, does anybody not understand that? That way I can just go over it again. I need everybody to have these talking points mentally prepared because these are conversations that you need to be having with your customers. I'm going to start calling my customers tomorrow, and then they're going to say, well, the individual mandate's not going to be here. I'm going to lose my cost share reduction. You can't watch the news. The news is garbage, right? I mean, no matter, you got to watch 6 different channels to get the right story. You know, it's like putting a jigsaw puzzle together who you're listening to. Don't listen to social media. I saw, you know, it's crazy. Is everybody, so I have one person that says they understand. Does anybody not understand? Because I'll move on otherwise. And I apologize if everyone is, this seems like a waste of their time. I just need everybody to make sure this is good to go. Okay. Well, that being said, I think that we are good. Let's just open it up to questions that you guys may have before I let everybody go for the day. If the individual mandate is removed, will Florida Blue make available a major medical non-temp? Probably not this open enrollment, unless they're hiding something from me. It would be a beautiful thing if we had a Plan 700 again. Oh, we would be happy, happy, happy. But you know, again, there's some sort of underwriting or there's medical questions that are involved. Peter, if you and your team need to talk about other short-term medical solutions, get with Ms. DeFalco. You know, she can talk with you about them. Florida Blue's got a temp plan. It's a paper application. I'll leave it at that. Any other questions, concerns, remarks, feelings? Anybody want to talk? Hug it out? Play the bongos together? What are you guys thinking? Everything all right? All right, so we will not be having a meeting next week. So you guys all have the week off. I sent out the reminder yesterday and updated the meetings for that as well. So if everybody is good, I'm going to let everybody go for the day. Thanks for investing the time. I'll see some of you at the road show. I'll be at the one in Tampa. Look forward to talking to you. Hope everybody has a great week and good luck. Thank you.